All right, welcome back. Just a tragic story. In fact, they laid this young girl to rest on Wednesday, and we are talking health with Dr. Scot Ackerman. Earlier this week, we told you about a Fernandina Beach High School student tragically died after battling what doctors are calling a form of mononucleosis, the kissing disease we know it as. About 3 weeks ago, the family of 17-year-old Ariana, they called her Anna Delfs, says that she started feeling cold and flu-like symptoms. She had a constant headache. She ended up having to be flown to the hospital where things got worse quickly. She started losing feeling in her legs. She had tunnel vision. Her words were slurring. They first thought it was a stroke. They took her to ICU where her family made the tough choice to eventually take her off life support. I can just only imagine how difficult this was for this family to see this just move so quickly. So Dr. Ackerman is in to talk a little bit about this. I mean, for the most part, as you just mentioned, it's Epstein-Barr, which leads to mono. And in 40-year-olds, 80 to 90% of people have this in their system.
So Epstein-Barr virus is the virus that's implicated in causing mononucleosis. But Epstein-Barr, not everyone with Epstein-Barr virus is going to get mono. Most people don't. Usually they're just infected with Epstein-Barr virus and nothing comes of it. Epstein-Barr virus is a member of the herpes family. It's very common. We can get it just by sharing a utensil. If I drink water out of your glass, you can get it. We call it the kissing disease because it's usually spread through saliva.
Right.
And so on utensils, that saliva, as long as it's still moist, you can contract that virus from someone else.
And you know, the dad said that it just was too far, too fast, and that this is something your body is supposed to fight. And that's what they thought would happen for their daughter, who was an athlete, she was an artist, you know, presumably a healthy young lady.
Mononucleosis happens a lot, and most people that get it, it's self-limiting. There's no treatment for it. We don't prescribe antibiotics or anything like that. So there's no treatment for mono itself. There's no way to eradicate the Epstein-Barr virus, but even so, there's no treatment when you have mono. So generally what we do is we provide what we call supportive care. So we treat the symptoms. If you're having headaches, we recommend Tylenol or Aleve or Advil. If you have a fever, we recommend those things as well. We recommend a lot of fluids and those sort of things.
When does it take this turn, though, like in her case with brain swelling, where it gets to that level that you have to be rushed to the ER?
It's very unusual, and you never know.
Yeah.
You never know. So when someone has it, you want to make sure that they stay comfortable and they're hydrated and those sort of things. But you can never predict who's going to have this severe case of it. You just want to keep them comfortable and support them when they have mono.
Do you think if they had caught this early, there are some things that could have been done to prevent the death?
You know, I've been thinking a lot about this, and it's tough because you don't know the progression. Could have been the same progression. But I guess if it was caught earlier, it wouldn't have been prevented, but if it was caught earlier and identified that she had some swelling of the brain, we would have given her drugs like steroids to reduce the swelling of the brain. But still, that might not have been enough. So it's hard to say what if, because there's, again, no treatment for the mono. It's not like if we diagnose a cancer early, we know we could cure it much more great than if it's diagnosed at a later stage because we can cut it out or radiate or whatever. But with mono, there's no treatment. We just want to give them supportive care.
Yeah. All right, Dr. Ackerman, thank you so much. You know, prayers for this family, because it's so difficult to have to go through this, especially now through the holidays. This Fernandina Beach family has started a GoFundMe account for the legacy for Anna's memory. If you would like to donate, you can find that link on newsforjax.com. And again, not to scare everybody, but it's good to be diagnosed, watch those symptoms, and then get to the ER if it does take this turn for the worse. Thank you, Dr. Ackerman.
Thank you.